Hello everyone. In this video, we will be talking about emergency contraception. So, for emergency contraception, we have usually various methods like hormones, antiprogesterone, IUD, and others. The indication for the emergency contraception are usually the unprotected sexual intercourse, the condom rupture, missed pill, delay in taking progesterone only pill for more than 3 hours, sexual assault or rape, and the first time intercourse as known to be always unplanned. In the days immediately prior to ovulation and on the day of ovulation itself, the pregnancy risk following a single episode of unprotected sexual intercourse has been estimated to be 30%. The indication of emergency contraception are after unprotected sexual intercourse UPSI, on any day of natural cycle, UPSI from day 21 after childbirth, and UPSI from day 5 after abortion, miscarriage, ectopic pregnancy for or uterine evacuation for gestational tuberculosis disease. The method for emergency contraception are usually the copper IUCD, that is most effective method, ulipristal acetate, second most effective, and levonorgestrel, third most effective. Copper ICD is toxic to sperm and ova. It inhibits fertilization and also prevent implantation. It is inserted within the 5 days of first UPSI in a cycle. It has both pre and post fertilization inhibition. Pregnancy rate is less than 0.1%. Copper ICD, it is gold standard method to be offered in all women for emergency contraceptive. Advantage, it can be kept in place for 10 years if desired as regular method of contraception. Next is ulipristal acetate. This is second best method. It is a progesterone receptor modulator. Ulipristal is progesterone receptor modulator, and single dose of 30 milligram is to be taken orally as soon as possible or within 120 hours of coitus. It acts by suppressing the follicular growth and follicular as well as both endometrial growth also. It delays ovulation and inhibit implantation. The overall pregnancy rate after ulipristal acetate is 1 to 2%. It should be neither be prescribed in women with severe hepatic dysfunction or nor with asthma. So it should not be prescribed in women with hepatic dysfunction and asthma. And third is we have levonorgestrel, that is also known as e-pills, 0.75 milligram, 2 doses given at 12 hours interval. It is very successful and without any side effect. The 2 tablets can be taken as a single dose also. The first dose should be taken within 72 hour, and the drug is successful in 85% cases. However, levonorgestrel cannot act at once. Alert surge has to be happen. Its mechanism of action can be due to the ovulation is either prevented or delayed, and the fertilization is interfered, and the implantation is prevented except by e-pill. Endometrium is rendered unfavorable by especially by copper IUD, and it interferes with function of corpus luteum. The nausea, vomiting are more intense with estrogen use. That is one side effect. Nextly, we have something called as USP method. That is combined hormonal regimen. It is equally effective. The 2 tablet of overall, that is 0.25 milligram of levonorgestrel and 50 microgram of 89 estradiol should be taken as early as possible after coitus in less than 72 hours, and 2 more tablets are to be taken 12 hours later. So this is called as USP method. Nextly, we can also use antiprogesterone as a emergency contraceptive. The antiprogesterone known as mifepristone. It is antiprogesterone. It binds to competitively to progesterone receptor, and it nullifies the effect of endogenous progesterone. Single dose of 100 mg is to be taken within 5 days of intercourse, and implantation is prevented due to its anti-progesterone effect. So mifepristone is emergency contraceptive, but it should be noted that misoprostol, that is also one of the abortifacient drug, that is not used as emergency pill. Only mifepristone is used as emergency contraceptive. So that was all about steroidal contraceptive. So in next time we will come up with a new topic in contraception. Thank you.